All right. Hello, everyone. How's everyone this Saturday? Oh, I see everybody's on mute. So I'll assume that you said yes. My name is Yasmin Maddox, and I am the founder and CEO of a company called Architect. We create web-based professional advancement tools for working parents. And if you're wondering, where does that factor into today's webinar and the webinar series, as a whole, we factor in like this. As we provide tools to help working parents advance in their careers, we, always have to be at the ready to step in and acknowledge when there are issues that demand, to be addressed. That such issue is how everything can come together more seamlessly for childcare providers and the families, the working families that they serve, particularly this fall. And so this series specifically is about preparing you all as childcare providers to really take on an uncertain fall, which, while it'll be uncertain, we do have the benefit, to use that term, of taking the knowledge gained and the data that we have at our disposal from the past few months to really chart a better course for ourselves for the fall and beyond, relative to what's going on with COVID, and more specifically to how I can help you, or how we can help you navigate the various challenges that you may be facing or you may face. So the first webinar in this three-part series was 2 Saturdays ago, and that was largely about how to really organize yourself better as a childcare provider with the use of technology, and with the use, more specifically, with certain apps, and software. This webinar is a bit of a deeper dive specifically into how to de-risk your operations. And when I say de-risk, I'm really talking about lowering your risk. Certainly out of all of the industries and all of the roles and jobs and careers one can go into, childcare is certainly one of the most important, one of the most invaluable, to use that term, but also one of the most high stakes. And I think we all know and understand and appreciate the reasons why. You are quite literally caring for, as this old saying goes, precious cargo, right? Not so much in the cargo form, but precious little beings, people's children. So ultimately, throughout this webinar, I want you to think of not only the information that is being provided to you, but the information in the context of what can I do specifically to my or for my childcare business that's going to help me do a better job really, taking on this fall. And if you have any questions at any point in time, please feel free to either indicate so in, the chat, or to unmute yourself and indicate so. So the agenda is pretty streamlined, but we're going to pack a good amount of information in it. First, we're going to go over how really you can do an assessment of your current operations, and also how you can help parents understand what your operations look like from the outside, since of course you are very familiar with what it looks like from the inside. Second, we're going to go over planning public health conscious operations. Third, we're going to be talking about mitigating risk factors that you may face. And fourth and finally, we're going to be talking about bolstering your preventative measures. So, first, assessing your current operations. Now, there are a number of ways to do this. Right now, I'm just going to show this, which I think is a helpful link, especially to send to parents or to have posted on your website in some fashion, whether a hyperlink or embedded. But really, these are tips on how to find childcare. Now, this is from the Cornell Cooperative Extension's page, and it's specific to Oneida County. But the information presented here overall is demonstrative of what you need to know just working within New York State. And something that's often most powerful for parents, especially now, especially as there are a record number of parents who perhaps did not necessarily need formal childcare before, the last few weeks, as well as those who previously did utilize formal or informal childcare, but now need it more than ever because of different schooling needs, especially for those who are in districts where, at least for the first semester, at least up until December, the holiday break, there will be 100% remote instruction. So what does that look like? How can childcare providers fill the void in a way that works for you, but also works for families? So this page is just great because it provides a checklist of questions that families, toil over, sometimes at 2 a.m., sometimes in the middle of the day during lunch or whatnot. And it always is a good look, to use that term, if you could share information that says, you know what, we're on the up and up. I know that I'm a business owner that does the best that I can to provide for the children in my care. Here, let me provide these resources for you, these checklists, so that you can really cross-reference what you find here by some of the authorities, so to speak, and look and verify that that's what I'm doing. So that's the purpose of this site, and perhaps of linking this site to your own website if you find that to be helpful. So ultimately, when you're assessing your current operations, the number one thing I want you to remember is that process is everything. If you at any point in time feel like, you need a break, like for instance, you just started, assessing your operations and already you're getting overwhelmed because there's a lack of organization or flow, to use that term, just think process is everything and lay out these key components of the process or the processes you need to go through. So when you start out, really you want to look at what's going on in terms of your business from a legal and an insurance perspective. Then you want to go to what's going on with your business in terms of the clients you serve, the families. And then you move on to what the state of affairs is relative to your personnel, to your staff, whether that's full-time staff, part-time staff, your personnel in general. And then finally, you want to have a good assessment or evaluation pertaining to your operations that's rooted in the soundness of your facility, whether you are, based in a center or within your home. So starting with legal and insurance, there are some considerations that I want to highlight for you, and certainly some questions. I would say more than anything, you don't want to just rely on checklists to help you out, especially to help you out over the coming, weeks and months. You want to let your own gut instinct, your knowledge of your industry, and your own questions, whatever questions are festering in your mind, you want to let those lead the way. Because oftentimes when you have a question that keeps on coming up that you cannot answer, that signals that it's something important that needs to be addressed. So for instance, the first few questions that I'm posing generally or rhetorically to you all are, what do applicable laws have to say about your ability to do temperature and symptom checks and disclosure of medical conditions? Are temperature checks, though in vogue, really that helpful? And how can they be misleading? So for a bit of perspective, when we ran this webinar series about a month and a half ago, and I was zeroing in on this slide, temperature checks were very much in vogue, to use that term. And a lot of people and businesses, certainly upon entering places of employment, were relying very heavily on temperature checks, okay? This, of course, is namely because unlike other symptoms of COVID, which can, to varying degrees, be masked or hidden, whether that's unintentional or intentional, and we'll go into the reasons for how to anticipate that. and how to mitigate that. Temperature checks are the easiest way, really, to see clearly whether one has a fever or whether one does not have a fever. And the fever aspect is significant because that is one of the red herrings of the coronavirus. So in June, when we did this webinar, we absolutely were saying, yes, follow the guidelines, follow whatever your local public health authority is suggesting, is encouraging, or even is mandating in some cases. However, over the last couple of days, there have been recent or newer developments in terms of how COVID presents to different people. And one of the leading authorities on the still very early research, Dr. Fauci on the coronavirus team, indicated that temperature checks often are, quote unquote, notoriously inaccurate. Now, I'm going to get back to this a little bit later, but for right now, one of the things I want you to I guess, chew on or think on, whatever term you want to use, is that, one, the guidelines, certainly as they're being given and suggested for places of employment, including, what would also constitute your childcare business as you employ individuals, are temperature checks of all who enters the premises right when they enter. But there's also something else to consider, and that is the fact that oftentimes you have cases where people, speaking of people who are trying to mask symptoms for whatever reasons, can take something that we all have, familiarity with, which is a fever reducer, such as Tylenol. And some people may even take it, not even doing it intentionally to mask fever, but because they're taking it for pain or, for a toothache or for something else, whatever else may be ailing them. And so I say this to you to say, when you look at these guidelines and you're thinking, okay, how can I reduce my risk? How can I protect the children in my care? How can I protect my employees, myself, and my business? Think of a layered approach in terms of, okay, it's advised that we conduct temperature checks as people enter. But we also know that, for better or for worse, if somebody is trying to get a child into our care, even though they may be sick, and we know that happens because long before COVID arrived, pretty much on a regular basis, parents were sending their children in who were sick. So you could consider not only doing temperature checks as somebody enters the premises, but perhaps depending on how long the day is for those in your care, taking a temperature 2 or 3 hours later, or some interval of time later that you can, determine perhaps with a call to your local public health department to say, hey, I realize that there's new research, there's new evidence that these temperature checks for a variety of reasons are not necessarily accurate. I also realize that in cases where somebody may have taken a fever reducer like Tylenol right before they came into my child care facility during the day, they may be okay when they arrived, but they may not be okay throughout the day. So in addition to just having a protocol for taking a temperature, if there are symptoms that something is amiss health-wise, would it be wise to also take temperatures at certain time intervals? Okay. So something to think about. And this also, you can refer to this article, and what Fauci noted has been widely reported in the news, but I, when it's possible, only will refer you to sources that are peer reviewed by the medical community or the scientific community. So that's one thing. And then, of course, how they can be misleading, I already went over with Tylenol and other types of fever reducers and the like. Now, if you're collecting health information or data, do you know your responsibilities? So while it's absolutely necessary to do what you can, certainly to comply with the law about gathering any relevant health information and data, you also have to know where the parameters are of your engagement so you don't run afoul of any laws, especially of any protections, not so much for you, but for those in your care or those under your employ, so your employees. So to better understand that, and I'm not going to click on these now in the interest of time, but you can refer to the particulars of the ADA, so the Americans with Disabilities Act, which this being 2020 is now officially 30 years old, or the GDPR, which actually stems from, it's a piece of legislation from the European Union, but it has bearing on quite a number of folks who have ties to the EU who reside in the United States. So for instance, a European citizen who is working in Monroe County, or who is working wherever your childcare business is located, who has a child in your care. So things to think about. Again, this layered approach that I'm hoping you instill in your business and your practices so that you don't miss anything. Because of course the government will provide these directives and guidelines and guidance as applicable to the jurisdiction in which they reside. But you want to, as much as you can, have more of a holistic and comprehensive approach so that you don't miss anything and nothing gets through the cracks. Are you providing advance notice to employees, visitors, etc., of what you'll be requiring of them to be on premise? Are you potentially creating systems that harm certain groups and or don't actively involve their input? So while, I probably sound like a broken record by now, while you absolutely need to comply with, what the government agencies are putting out there for you, you also want to be sensitive to the fact that some of these guidelines may seem invasive. There may be instances where some of these guidelines may potentially be perceived to create harm. Again, something that I'll dig deeper into a little bit further on is the fact that in terms of an ethical approach, it's certainly our hope and your hope that any employees who feel sick, especially if they feel or believe they may have been exposed to COVID, would not go into work. That said, we know, especially from earlier on in the course of the pandemic, so going back to April and May, at least some of the spread was because, one, people didn't think it was that big of a deal, and to some it's not, but to others it could be fatal. There's also the consideration that for people who are unsure or unfamiliar with what financial aid, to use that term, resources are available to them, financial considerations of how am I gonna put food on the table, how am I gonna keep the lights on and keep a roof over my family's head, may be at the forefront of their minds. And so while one would hope that one would not potentially endanger other people because they have a fear of not being able to get paid from their job, it is nevertheless something that is already and has already happened and will likely to continue in some fashion. However, if you are aware of these things, you can provide resources discreetly so that people have the information they need to de-risk the chance that they are going to knowingly go to your place of employment to work, not only to work with you and potentially expose you, but to also work with children in your care to meet their needs. So you also, as I mentioned, you want to be familiar with what some of these conflicting issues or thoughts may be in some of your employees' minds. And also, how are you keeping any collected data safe?
So those are the key areas that you really want to be thinking about in terms of when you assess your operations, okay? You also want to consider these policy considerations. You want to familiarize yourself with policy or policies and the particulars, including property/business interruption as it relates to your insurance and whatever type of policy you have, including any riders you have. Property/business interruption policies cover, among other things, the cost to clean up contaminated areas, which is now more important than ever, loss of revenue, vendor costs, refunds, notification costs, etc. So something that I want to highlight, and I think it's important to note, New York is doing exceptionally well in terms of our COVID positive case rate. I think Monroe County right now, and don't quote me, okay? Take this in good faith, but I'm pretty sure that when I was reading to get the most recent stats, it may have even been yesterday, if not yesterday, certainly the day before yesterday, our positive rate is 0.4%. That is phenomenal. That still means that some people are getting sick, but the vast majority of people do not have COVID, okay? However, you always want to operate as if at any point in time on any given day, that rate can shoot right up. Now, however, how likely that is remains to be seen, but something to keep in mind, especially as you look back through your records for your insurance coverage. Going into fall season, we may very well find that even though COVID rates do not go up precipitously, flu cases most likely will, because it's something that we are accustomed to, we know happens every single year. And because there's such an overlap of the symptoms of the flu compared to COVID, there's very, much likely the possibility that there may be closures at schools, closures elsewhere, because people may just be concerned that what is actually the flu may look like COVID. And so you have shutdowns to varying degrees, if only to conduct testing, and if there are positive cases to do, contact tracing. So with that in mind, you want to know what you have at your disposal, what your insurance coverage currently claims, what exclusions currently exist, especially those relating to communicable diseases, so you can seek out additional coverage before the fall if possible, when there's believed to be an uptick in COVID cases. And that's not so much in Monroe County necessarily, but it's a possibility. But certainly in other areas, as some of the southern states have demonstrated, with a number of school systems opening up, and then by the second or third day, certainly within the first week closing down and transitioning to 100% remote/virtual instruction. You want to document your specific COVID-19 processes and the incidences of infection, including specific timelines, so you can efficiently and effectively advise your insurer if needed / if when filing claims. Now, surely, okay, don't think that I think that you've got lots of extra time on your hands, because I know that in your industry, time is at a premium, okay? There's a lot to do. But you could set this up by using actually the web app that I'm presenting on right now, Beautiful AI, because and I'll move back right here. You can lay out your processes in the same fashion that I've laid out these key categories, and you can do it on Beautiful AI, which does have a free basic membership, and then if you get premium membership, it's $12.99, I believe, a month. Okay. But will allow you to put together these types of documents that you have at the ready, and that's already in digital form, so you don't have to worry about finding pieces of paper, where figuring out where you may have put it in your office. So now, assessing your current operations with regard to clients and families, the heart of your business, those who allow you to stay in business, those who you serve. What are they thinking? And how can you alleviate at least some of their fears? Now, I'm an overachiever, okay? But I'm not delusional. I know very well that no matter what I or what Architect does, we can never alleviate all of the fears of those we serve. And the same is going to apply to you, even more so, because you're working directly with children. But you can assess and understand those families' needs by conducting a needs assessment, which I highlighted in the first webinar, and is accessible through the slides from that first webinar. You conduct the needs assessment, and then you zero in on what clients, what families, parents are saying. So, for instance, I've highlighted a few quotes taken verbatim. The first is, my child adapting back into a routine that doesn't include me 24/7, making sure that transition is supported. So as you envision how you're going to, tackle the fall and what you're going to do, you're going to obviously look at the ways that you can de-risk your business in terms of legal, insurance needs, etc., but also in terms of the more murkier but very important social emotional needs of not only the kids in your care, but their parents. So how do you help both of those groups really transition into being in your care, either in a new way, if they are switching it up based on schooling needs, welcoming, families who previously had used your services in a limited capacity. How are you going to help them adapt to a new situation? So just as it was a new situation when schools abruptly shut down in March, it'll be a new situation when schools reopen. It'll be, to use the term, hopefully this applies, really ambivalent perhaps, or an uneasy transition for some, because in the back or perhaps forefront of everybody's minds is going to be, how long will this last? And if it doesn't last, how can and how will you as my childcare provider be able to support me and my family and my children? So that transition, how you approach that is crucial. Consistent cleanliness. Now, surely we all know that cleanliness is important. To some parents, really not only is it a matter of cleanliness, but of communicating that to them. So in a couple of the surveys that we did, it was interesting to find that not only did parents want to know, confirmation that a provider had cleaned the premises, either, on a daily basis or weekly basis, which we already know already happens, but when, okay? So it wasn't enough to have the abstract verification or confirmation that cleaning is being done, but they roughly want to know when, because all of that information helps to create or put together more of the puzzles, more of the pieces of a puzzle involving the care of their child. So keep that in mind. Another parent said, having them close again and being left with no child care. Sorry, having them close again, meaning schools, and being left with no child care. So again, what plans and contingencies do you have in place if schools should shut down, and for how long? Are you ready to fill that void, or would you be in a position where you're so overwhelmed that you can't really operate yourself, at least with capital to help you out, that may not be available in a bridge loan type of situation? So to that, the question that we would pose to you is, Have you formed partnerships with other organizations, including other childcare providers, to ensure continuity of care? Rather than, potentially treating yourselves or seeing yourselves as an island, think of the childcare providers in your neighborhood, in your area, as part of a wider community that you can and should be leaning on and regularly communicating with to problem solve. So that if one of you finds that, there are a lot of parents who are increasingly very nervous and pull their child out for whatever reason, and so you have to shut down, is there some place, a partnering daycare, for instance, that you can work with for a certain amount of time, or vice versa? So think creatively. No ideas are crazy. Think of what partnerships you can make, not only with other childcare providers, but with employers, with agencies. There have been a lot of interesting things going on in terms of, if you're familiar with them, schooling pods or clusters, as some are calling them, and figuring out, okay, what's a mutually beneficial partnership that we can create with another organization. It could be a private organization like a nonprofit or an employer, which oftentimes are for-profits. It may even be with your local municipal government, but you don't know unless you at least jot down some ideas and test them out by making phone calls or by sending, form letters to gauge interest, to gauge demand for that. Day-to-day care procedures, checking in with me and my son's father, food tracking, location tracking, direct contact with others that have been sick, and then the parent put in parentheses, must be responsible and dedicated to the role, the consideration of COVID-19 vaccination, and staying up to date with the news. So clearly, in the midst of the quotes that I've laid out for you here, this parent is thinking through a lot of different details. They want to know a lot. And so how are you going to ensure that you are providing that information in short form for those who are like, you know what, I'm pretty much hands off. I can see that you're doing a great job. I can see that you're doing what you need to do, as well as those who are very much hands-on and crave that information. You should be able to provide it to them in a way that is as efficient and as seamless for both of you. And then lastly, one parent asks or says, whether my child will contract the disease, what the long-term effects of the disease are. So now, while we do have a number of smaller empirical studies, admittedly, the sample sizes of those studies are small. And when you're doing studies with children, there are always additional challenges to be overcome in terms of what is ethical to do, right? And so we don't have the information about the long-term effects of COVID. But again, you can provide information on your website in a special section that is either, on a page that's titled updates, or you could even do a page that's titled peer-reviewed, COVID, peer-reviewed literature and updates, or something to that effect. And then you hyperlink studies that are free and therefore easily accessible to those who have internet access. And you provide that information. And you say to parents, look, I know that you are concerned about the long-term effects should anybody, get it in this facility, or be exposed to somebody who may have come to this facility. Here's the information that we can provide. And these are studies that really have the best information to share. Not all information necessarily is going to alleviate all of these fears, but all information is good in the sense that, if nothing else, it'll help better inform your next steps, okay? And for parents during this time, that's critical. And you could find those studies just by going to Google Scholar. Feel free to answer either in the chat or by unmuting yourself and saying, I use this, or I've used it, or I know of it. Who here is familiar with Google Scholar? Anyone? Okay. So unless folks are being shy, perhaps. Okay, I see. Okay. So, excuse me. Patricia indicated, thank you, Patricia, for offering up that information. So she indicated she is not familiar with Google Scholar. So, excuse me, let me just take a sip of my drink for a second. Google Scholar is a free tool provided by Google that provides access to digital, because it's online, digital copies of peer-reviewed research literature, ranging from the humanities to astrophysics to the biological sciences to communicable diseases, all of it. So think of how massive Google's repository of information is. And they have a tool that provides that same information in the form of peer-reviewed literature. Thank you, Nicole. So it's a wonderful, absolutely wonderful tool that you can, embed or provide a hyperlink to from your website. So parents know off the bat that not only are you really concerned about how they're feeling and the information that they are able to attain, but you go a step further and you provide that information to them at the click of a mouse. So I would recommend it to you to at least consider putting it on your website. And if you are not familiar with how to do that, or you need assistance with doing that, please feel free to let me know either in the chat or via email, and we will certainly help you with that. That is part of the technical assistance that you get from Pathstone. So now, assessing your current operations with regard to your personnel. Okay, so whereas the children in your care are really the heart of your operations and the business, your personnel, that's everything else. They are your direction, right? They give you direction. They are the ones that make it happen. Without them, you can't do that much, especially for those of you who have multiple employees. So what we suggest is an exercise that's often done in college classrooms, especially classrooms that are for business students. And it's a great exercise. It's useful. It's not, while it's academic, it's practical. Okay, so we suggest that you do a personnel/employee SWOT analysis. For those of you who may not be familiar with what a SWOT analysis is, SWOT is an abbreviated term. It's an acronym that stands for strengths, weaknesses, opportunities, and threats. Now, this analysis should be done with each individual employee in a time that is convenient for both, in a location that is really confidential, right? So it may not lend itself to being done during the workday, but in some cases it may, as long as you have some area space that you can steal away with, each particular employee. So the questions that come to mind for a SWOT analysis are, what are your employees' strengths, okay? The S. What are your employees' weaknesses, which is, of course, the W. Now, even though SWOT includes that W for weakness, and typically you do a SWOT analysis when you're trying to assess your strengths, weaknesses, opportunities, the opportunities that are available to you and threats posed to you in the context of your business, but you can do it in the context of people. For obvious reasons, really you don't want to hone in on calling somebody out for their weaknesses, right? The more human-centered or oriented approach would be, what are their areas of improvement? What are things that they can do, that they can improve, they can get better at, right? Not posing it in the context of a weakness, even though that is the formal or official title. What opportunities can each individual employee help your business to realize? So something that few business owners do, especially childcare providers, even though there are a wealth of opportunities that you can explore, is to think about where your employees work. Okay, now nobody's saying try to seek out your employees on Facebook, right? Because that can open a lot of can of worms. Okay, but you could certainly ask them, if you feel comfortable and if you believe they would feel comfortable based on the type of rapport you have with your employees. And you could do this through an anonymous, free Google form survey. If anybody has, if anybody's a membership at a church or at a community center, or if anybody has any connections to somebody at the local radio station, or at the local, news station, etc., that can be used for marketing purposes, for one. So for instance, if you have at least one or a couple of employees who are, members of a church, a temple, or whatnot, see if they'd be willing to speak about the childcare service that you are providing, especially once you've completed the initial task of innovating any certain additional services that you can provide to families in the fall. Again, given the unique nature of schools reopening plans, some of which are going to be 100% remote/virtual. So think of how your employees can be a conduit to other opportunities to you that typically may be closed off to you if it were not for those employees. And then think of what threats to your employees' ability to do their best work exists. So inherent in this, I would refer you back to what I was talking about regarding concerns about finances being potentially an incentive, or either an incentive to go to work when sick, or a disincentive, to stay home when they feel sick or to get tested. So you review this information and put together a plan to activate, to use that term, your employees' strengths to improve upon areas needing improvement, skill sets, etc. And then ultimately you ask yourself, okay, now that I've done that, where can I address inefficiencies? Where can we make things more effective and quicker, right? Because there's a lot going on. How can you streamline processes so that you're more nimble? Because when you're not nimble, it often leads to costs, whether it's a cost in actual money or a cost in time. It all adds up to costs that you should not have to incur. So this is what the SWOT analysis sheet looks like. And when you get the follow-up email from this webinar with the slides, you can print this all out, or you can just get a blank sheet of paper and do your own, your own setup like this. So then you want to consult safety checklists to refresh your memory and to layer preventative measures after you've considered your legal and insurance, particulars, and then you've gone on to what's going on with clients and families, and then the state of affairs concerning your employees, your personnel. You want to look at your facility. So you want to consult safety checklists to refresh your memory, right, of things that perhaps you absolutely knew needed to be done when you opened up shop, right? And to layer preventative measures. Again, you already are referring to, these immense guidelines, directives, mandates in some cases, right? From the state, from your local public health departments or authorities, which is great. But you want to add in information as you are able, understanding that, again, those authorities don't have all of the information, and quite honestly, they don't focus on information outside of what's within their domain. So I always tell people, they've been around for a long time, and there's a reason for that, because they're good at what they do. So a really just straightforward checklist, safety checklist, you can get from the Gerber Life Insurance Company. Now, there's also checklists and the like from New York State's website through the Office of Child and Family Services. But I think this one is just really nice. It's relatively quick, and it gets to the heart of the issue, right? So it lays out checklists according to walls and windows, outdoor play areas, indoor play areas and adjoining rooms, infant cribs and changing tables, safety procedures and devices, and bathroom. Now, a main reason for me using this particular checklist is because I aesthetically, I like how everything is broken down into the boxes, and then you can, literally check it off. But you could also write in the margins, which is what I would absolutely encourage you to do, because you can go through this checklist while you're also considering what COVID-related directives have been sent out by the state and increasingly by local public health departments. Now, even though you are not schools, right? You all are operating childcare businesses, daycares, whether in home or center based. You're not an elementary school or a middle school or a high school, but you should, if you are able, and I believe, you are able either independently or with assistance from like a entrepreneurial or business service provider such as Pathstone, you absolutely should be familiarizing yourself with the benchmarks and guidelines that have been given to schools to get a sense of what the state is thinking in terms of safety measures, because all those safety measures exist for one key reason. And that reason is the topic of today, which is how to lower risk, ultimately lower the risk of children contracting COVID. But as far as you and your business are concerned, whether COVID stays with us for, the rest of all time, or whether it, becomes a fleeting thought within a couple of years, you want to be doing what you can to lower the risk for your business in general. And again, with COVID in mind for the fall. And so you want to look at each one of these items, okay? You want to think about what's relevant to your business in terms of your particular setup, what perhaps may or may not be applicable, right? So you can do a spot check of your rooms and your facility to see if paint is peeling. That may very well be more applicable in a home that was built perhaps in 1952 compared to a center that was just completed in 2009, whatever the case. See what applies to you, but then also dig a bit deeper and see on a number of other levels what also is relevant. So case in point, there are a lot of restrictions on, as we know, on spacing, right? So for instance, it's advisable not to, in some cases mandated, again, refer to the guidelines provided to schools regarding reopening, to maintain physical distancing of at least 6 feet. What does that look like for you in your space where the kids in your care are mostly situated? Is that possible? Is that possible with the current setup you have? If it's not possible, what do you need to make it possible? Is it just a matter of rearranging furniture? Is it a matter of quickly assessing and seeing that you need some kind of funding, some kind of capital, whether it's $500 or $3,000? Is it necessary, or would it be beneficial perhaps to give you a competitive edge, to use that term, to get, see if you can get a grant or see if you can qualify for a small business loan to add on additional space, not only so that you can meet these types of requirements, but that so you also have additional space to bring in more children, and serve more families. What does it look like for you? And you could use this checklist to go boom, 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 point by point, and assess those issues. All right. Section 2, planning public health conscious operations. For one, I'll start with the question of what does it mean to have a public health conscious operation? To us, at least, at Architect, it means to have operations where you intentionally consider the data and knowledge available to you to help ensure that your operations protect the public health by protecting the well-being of those in your care and under your employ, okay? It's not about removing every single risk known to man. That's not possible, and it's not reasonable, okay? You want to do what is right by those you serve and what is reasonable, okay? And oftentimes it could seem like you might think, oh, I need to do this, I need to do that. Think of what you need to do in the context of what's reasonable. Is it reasonable that you, as a new parent, new parents want to protect their infants, especially infants that are starting to crawl and move about. They want to protect them from everything that could possibly harm them. Would it be reasonable to cover the entire house, with baby-proofing equipment? Not the places that need it, but the entire house, right? Just have a house that could double as some kind of setup like you would have in some of these bounce house facilities. No, because that's not reasonable. You can achieve basically the same thing by lowering your risk just without the added cost. So think of what's reasonable. Now, there are 3 intersecting elements of public health as they relate to the children in your care. Their physical health, and with COVID in mind, many, if not most, of the directives and guidance has been along the lines of physical health, right? Because even though mental health and social health, but certainly mental health, is extremely important, the thinking goes, if you are at risk of death, okay, however that may shake out, then while the mental component of what a child or what their parents may be going through, front and center is the most important, is shoring up one's physical health, right? Shoring up one's body. But mental health is a part of that scenario. So while physical health has been the dominant consideration, it's not the sole one. And increasingly, if you've been paying attention to what the guidelines and advice given to schools regarding school reopening plans, including in the state of New York's reopening guidance, mental health and social health have been, and emotional health as they call it, have been key pillars in what needs to be considered because they matter. And oftentimes there is a direct impact of one's mental health and social health, or lack thereof, on one's physical well-being, and vice versa. There's a bi-directional relationship. So knowing this, you would do well to refer to, and this is the CDC's website, guidance for childcare programs that remain open. So this was updated as of July 23rd, and the information is still pretty much the same, but it has all of these points, as you can see, general preparedness and planning, screening, etc. But you also want to complement that information and supplement it with what you can find regarding mental health and social health. And you can do that in part by referring to Google Scholar, peer-reviewed literature, and by also reaching out to your local public health department, because, and I may sound like a broken record again, one of the best things about local public health departments is that we already pay for them, okay? You can get information from them that they readily and happily provide for the public good and for the public health. That's relevant not only to physical health, but also mental health, because that is a part of our overall health. So utilize them. There are also, actually, and I see I had an incorrect slide here. There are two main intersecting elements of public health as they relate to your employees. So whereas the social component relates to the kids, especially because younger kids really get more so than older children and adults, they get the benefit of learning how to socialize with their peers, right? With your employees, with your personnel, really the intersecting public health elements are their mental health and their physical health. Their physical health, of course, is relatively the same as that which you would consider concerning the kids in your care. Their mental health is different because you're working with and you're employing adults. But considerations regarding their mental health pretty much zero in on the stressors that they may be facing. So the question that you need to be asking yourself is, what stressors are your employees experiencing? And are the lines of communication open with your employees, which are questions that apply both to their mental health and their physical health, but the latter more so applies to their physical health. So you know that if they are under immense financial stress, they may not make the best decisions regarding their physical health or regarding how they engage and show up literally and figuratively to your place of business. By de-risking, when we say de-risking your operations with respect to this, it's not anything, underhanded or legalistic. It's rooted in just being a good human being, of continuing to ask your employees how you can help them, of providing resources that you know will help them based on what they've articulated to you as their concerns before they even ask. Because we know that some people, especially employees, don't feel comfortable asking for help, especially if they believe that asking for help will be some kind of admission that, everything is not perfect in their life, and nobody wants to fear the potential of losing gainful employment. So primary physical health related guidelines, right? We have the guidelines that are now old hat, so to speak. Physical distancing, static group size and composition if possible, face coverings. I will note this because this is relatively hot off the press. And again, this information can be found, I believe I've hyperlinked it right here in this research article, which was published as of August 7th. So it's very recent. And this is about a test that was done comparing the effectiveness of pretty much blocking particles, viral particles and bacterial particles, but really viral particles through certain medical and non-medical grade face coverings, right? So we have different types of face coverings these days. We have surgical masks, which people are still wearing and which people primarily were trying to find in the earliest days of April, March and April. And then people started making their own. What was found in this particular test was that pretty much all of these face coverings held up, except, and did they show the picture of the potential offender? All of these pretty much held up, including bandanas, but the one that was found to be essentially ineffective were gaiters, what are referred to as gaiters. So if you don't know what a gaiter is by its name, hopefully the visual can help you. A gaiter looks like pretty much the turtleneck, what makes a turtleneck, okay? You pull that over your mouth and your nose. And those were found to essentially be ineffective at keeping out viral particulates, especially COVID, okay? So you always want to be sure that you are up to date with these guidelines, especially as it pertains to the health and the medical data and information, which you can do freely, literally and figuratively, through Google Scholar, among other resources such as your public health department. Regarding dedicated child drop-off and pickup spaces and procedures. An example of a survey response that one of the parents provided us was, parents/guardians are not permitted to spend an excessive amount of time in the child care or day camp facility, which is absolutely true. And we know the reasons for why that is. The reality, however, that we want you to, think more about if you're not already, is that you should be thinking of how you can include policies that achieve your goals, especially those that are aspirational. So those that you want to do because you believe it's a good idea, the things that you need to do because you need to do it to comply with, state law or executive order, but also those that acknowledge parents' need to ultimately comfort their child or children, whether that's perceived as an actual need or whether it's just something that they desire. Again, going back to at least a couple of the quotes provided from parents who completed our surveys. This is a rough time, not only for kids, but also for parents. And so what families had previously been used to, which was not necessarily taking all daggone day to say their goodbyes, when they were dropped off at your facility, but to have more time, even if they didn't use up all that time, to have the knowledge that if they wanted to hug on their kid or kids a little bit more, they could do that. Now that's really not available to them. So how can you have policies that achieve the regulatory goals or objectives that you have in place in a way that is human-centered, right? In a way that says, you know what, we can't let you do X, Y, and Z because we have to, again, lower the risk of possible COVID transmission. But what we can do is, even though we didn't do it before, we could send you a text through, SMS system, either through MailChimp or another, provider that sends you a picture of your child, say at 10 o'clock or at 12 o'clock or whatever the case may be, roughly when people's lunch hours are. We can do that. So even though you may be missing that initial drop-off affection to which you were accustomed, we can meet you, so to speak, halfway and give you something else that'll help you, and that'll also help the child if they know that a picture of them doing something fun or goofy or whatever the case may be gets to their parent before the end of the day when they reunite. So things like that. Soiling of children's clothes. So one of the guidelines has to do with soiling of children's clothes. Specifically, children in childcare or day camp programs should have multiple changes of clothes on hand in the program facility or area. Responsible parties should make efforts to have spare changes of clothes for children who either do not have extra clothes or have used their extra clothes as practicable. So that all sounds great, but not everybody has extra clothes, okay? Not only just for a matter of financial reasons, but also they may not have the time to wash extra clothes to send, whatever the case may be, right? Families are strapped. They're under a lot of pressure, as many childcare providers like you are as well. And so to have some extra, clothes on hand, again, following public health guidelines, you could sign up for groups like Buy Nothing groups on Facebook. And if you're not familiar with what they are, They're quite literally what their name suggests. They're groups based on geographic proximity. So say it's a 10 block or maybe even a 15 or 20 or 2.5 or 3 mile radius, where people within those parameters or perimeter exchange at no cost with each other goods that they no longer want or need. Now, with other marketplaces, to use that term, there's always the possibility that some things really should not be exchanged to anybody. Some things should just be tossed out. But in a lot of these groups, and I am a member of one of these such groups, there are really great items that you can get, namely clothing. And so, or even supplies, for instance. I know in one of the groups that I'm in, somebody was getting rid of like a love seat, right? And the love seat had pretty much just sat in a shed because initially their measurements were off, and so the love seat could not fit where it was intended to go. So think outside of the box in terms of seeking out these marketplaces and things that are similar to marketplaces, so you can get these types of resources, in this instance, clothes, so that you just have it handy for those when there is a need. Okay. Mental health considerations as they relate to the care of children. As I mentioned a few times already, provide materials that are readily available to parents. Parents have exceedingly little time to research a lot of this updated information regarding these issues. Make life easier for them. Not only is it the right thing to do, but it's a differentiator in your customer service. It makes you look better. It shines a better light on you. Provide parents the option to opt in to permitting you and your personnel to answer questions children in your care may have about COVID-19. So for some families or parents, this works. For others, it doesn't. But before you potentially are perceived to cross any boundaries, consider having just a standard form. It could even be a Google form, which is free to use, where people opt in, where parents or clients opt in and they say, yes, I permit you to speak to my child about such and such. And you can provide a box, a paragraph or short answer form that allows them to type in if there's anything specific that you can cover with them, or if there's anything specific that they do not want you to speak to them about. So you're not left wondering, questioning, can I do this? Can I say this or whatnot? You can consider incorporating activities that reimagine socialization skills. So again, socialization is a huge part of the daycare experience, and it's a wonderful part. I still have memories from games and circle times that I had when I was 3 and 4 years old, literally my earliest memories, okay? You can reimagine them. You have the ability and the opportunity, unlike any other, to do so. Advise parents of resources that can help them, that can help their children with their learning and coping needs. So one of the resources that Architect provides on one of our product sites is this page devoted to learning and coping resources. And pretty much it's a combination of resources relative to educational needs, resources available to educational needs specific to certain families. So if there's families that have a child with special needs, whether that's related to being deaf or hard of hearing, there are unique tools that they can access through this portal, as well as really fun interactive websites that you can actually use yourself in your daycare facility. So like the Smithsonian, another one's National Geographic Kids, another one is Explore, inside the orchestra's Tiny Tots, where there are actual orchestra presentations that are actually designed for the hearing enjoyment of little kids based on what they have said they like to hear based on what we call customer discovery, which is a combination of interviews, surveys, etc. So that's something that you have at your disposal as well. Mental health considerations as they relate to employees. You can send out weekly emails to employees to quote unquote check in and provide helpful resources. You can do this with a free plan through MailChimp, providing information about free to low cost activities and things that can help with recognizing stellar employees. As this says, whether it's an employee appreciation day or any other day, rewarding your team for their hard work is always a good idea. And in this generally stressful time and uncertain time, sometimes the best thing to do is just either say thank you or just be creative in showing your appreciation. I have worked as a relief worker, part-time on call for a mental health agency for going on 13 years now. And it's something that I do. It is work, it is a job, but really it's a passion project for a number of reasons. I really enjoy working with people who are really trying to improve their lives by addressing their mental health needs. Okay. And some of the best days ever, even when you're having a crummy day and you're, you show up to work, or when somebody when a client, a resident has indicated that you are a quote unquote shining star. Things like that feel good. Things like that make people feel like they are part of something greater other than just, rote or routine aspects of their day. So don't forget to really think about those simple, easy, free things you can do to help your employees' mental health. Again, because it's a good thing, it's the right thing to do, but also because it helps to lower your risk that your employees are not going to be in the best spot mentally to do the very, very serious and rewarding job of caring for the children who are in your care. Provide financial aid resources and tips to them, okay? So right now I've provided a hyperlink to the Office of New York State Comptroller, and you can find broken down into categories the information, finance related information regarding your health, the CARES Act, employment issues, paying your bills, assistance for small businesses, which of course would apply to you, local government and nonprofits, personal finance information and education, avoiding scams, which is very important right about now, even though there are lots of people who are doing their level best to help their fellow person. There are also those who are not doing what is kind and trying to scam people out of perhaps what little money they have. So you can provide, a link to this information as part of a weekly employee check-in, newsletter, and say that those two hyperlinked resources are always in your footer, right? Where your business name is and the contact information. And then as different things present themselves, throughout the week, you include them and you give people heads up about something, just to keep people in the know, to use a term from my adolescence. Mitigating risk factors, okay? Really quickly, you want to break down or organize your mitigation of risk factors in terms of health risks, safety risks, and personnel and operations risks. Now, provision of water and food is always important. When we first ran this webinar, it was really the beginning of summer vacation for kids, as schools had just really completed the year. And so there was more of an emphasis on making sure that there's enough water, certainly for hydration purposes, to avoid things like heat stroke and heat exhaustion, and food. But you want to be clear, again, that you have in writing somewhere, not only for you, but for everyone to know what the procedures and protocols are related to, you know, water and food, non-COVID-19 sickness, COVID-19 sickness, face coverings, temperature checks. So for instance, if you were previously allowing employees to wear gaiters based on the study that I highlighted, are you still going to permit that? Or are you going to err on the side of caution based on that study and say, you know what? If you want to wear gaiters on your own time, I can't prevent you, but from here on out, based on this peer-reviewed literature, as an employee, you need to wear a face covering that is anything other than a gaiter, or, you know, that is X, Y, and Z, whatever the case may be. Temperature checks. I think, you know, we pretty much opened with the changes that have happened, you know, over the last few months with temperature checks. They are useful, but don't put all of your eggs in one basket. Try to see if there is a more sensible or reasonable approach to using temperature checks in a way that does not give you a false sense of security. Okay? Just because somebody shows up, you know, in the morning with a 98.6 or 98.7 degree or whatever temperature doesn't mean that it won't increase to 101.3, you know, within a couple of hours or by the end of the day. Safety risks. You want to consider what cleaning solutions you're using, and are they child oriented, for instance? So are they composed of chemicals that are less noxious and harmful to children than other types of cleaning solutions? Are they cleaning solutions that have been proven to be more effective perhaps than others when disinfecting, you know, areas contaminated by the coronavirus, you know, which is what causes COVID-19, the disease? We've provided for your review the link to the Environmental Protection Agency, the EPA's site, where they have right here a nifty tool where you can search products that meet the Safer Choice standard, and you can read up on what criteria they use. But they have it broken down into a number of filters, whether it's for your home or your business, or you know, whether, you know, the product type is specific to an aircraft like carrier, whether it's you know, specific to something that needs to be used exclusively, or for septic systems, because for instance, and my home has a septic tank, for instance, we cannot use bleach. We cannot use bleach because it'll disrupt the pH balance that the tank needs to have so that it can break down waste in the chemical process that it naturally undergoes. So this is, again, a free tool provided by the government, federal government, because the EPA is a federal agency, that can help you out tons in terms of what products you can and should be using, and figuring out not only what products, but then taking it a step further and looking at what suppliers, what stores have those products, and if you can get them for a more affordable price. Safety risks to be mindful of in terms of your considerations include atypical clothing / coverings, whether it makes sense to invest a few dollars per box in shoe coverings or slippers, which have been known for a long time in the real estate industry, when you go to, you know, home tours or open houses rather. And then, as I had mentioned before, spatial awareness issues related to space becoming smaller due to physical distancing guidelines. Because not only do you need to consider the public health implications regarding COVID, but also the potential for personal injury implications if you have even smaller space, and therefore spatial awareness issues. Personnel and operations risks. The financial issues, including debt, that I had mentioned several times throughout. Employee health issues. So for instance, what of requirements to wear face coverings for those whose medical conditions may preclude such usage, or at least
may add complications. So asthma is one consideration, or allergies, which could indicate that you need to look at not only that employees bring in their own face coverings potentially, but that whatever face coverings you have may be hypoallergenic. So for instance, the best analogy I could give would be for gloves. It used to be that standard disposable gloves were latex until it became apparent that a lot of people, myself included, are allergic to latex. And so now you see oftentimes in medical facilities, you have one of the very first questions that you may get asked is, especially if you're a patient, do you have any allergies, including latex? Because if you are, then the provider will then use vinyl. So considerations like that. And do you need, after you've done these assessments, do you need any additional insurance riders? Lastly, bolstering preventative measures, okay? So I'm just gonna go over, really read aloud a few quotes from the guidelines that have been provided by the state of New York. Community mitigation efforts aim to reduce the rate at which someone infected comes in contact with someone not infected, or reduce the probability of infection if there is contact. The more a person interacts with different people, and the longer and closer the interaction, the higher the risk of COVID-19 spread. So I mention this in particular because due to the varying nature of school reopenings, there are surely, it's already been determined, going to be cases where school children, especially the littlest of school children who are still by age eligible for the daycare services you provide, are going into school maybe just a couple days a week, and then being entrusted in your care. And so, for instance, you have not only the potential risk of spread concerning that one particular child based on their interactions at their school, but also based on their interactions at your facility. And then you multiply that exponentially by all of the children within their school or within a particular, 5-mile radius or a school district, et cetera, et cetera. So considering that, you want to take, these assessments and considerations that I've been advocating for and I've been explaining for the last hour and 20 or so minutes, really with this reality in context. This reality really wasn't at the forefront of many people's thoughts, even in May or June. But once the state provided guidelines to school districts on July 13th, and school reopening plans among those districts started to take shape, with it being clear that there was going to be, for many, a hybrid situation, this particular consideration is now extremely important in terms of what you do, again, that is reasonable, that is rooted in good faith, to ensure that while this is reality and there's not much to do to avoid it, you de-risk as much as possible. Each community is unique. Appropriate mitigation strategies should be based on the best available data. Decision-making will vary based on the level of community transmission and local circumstances. So as I mentioned before, Monroe County is doing exceptionally well. The state of New York is doing really, really well in terms of our transmission rates, our positive case rates. That said, each community is unique. And just like an actual town or village or city and its various neighborhoods are each unique, so too is your daycare center, whether it's in-home or center-based. So considering that uniqueness, you need to look at these guidelines, these directives, these suggestions as
part of a lens that is specific to you and to nobody else. You can certainly do a comparison of others to get ideas, to share information, exchange ideas. But everything you should do should be rooted in the fact that your particular facility and business is wonderfully unique, okay? The characteristics of the community and its population, health system, and public health capacity, and the local capacity to implement strategies are important when determining community mitigation strategies, okay? So ultimately, what this really gets at is, it's not only about you and what you can do to lower risk for your business. Everything that's going on inherently demands a teamwork approach, right? So as the saying goes, teamwork makes the dream work. So don't be afraid, again, to reach out to your local public health department. Don't be afraid to reach out to schools within the district in which your facility resides. Engage, interact with potential partners where you see a mutual benefit, because ultimately they will help you and you can help them by providing the needed information that everybody needs that can help our health system and help our particular communities. You do a better job of serving your needs, of serving the needs of working families and beyond. Community mitigation strategies should be layered upon one another and used at the same time with several layers of safeguards to reduce the spread of disease and lower the risk of another spike in cases and deaths. No one strategy is sufficient. So again, don't put all of your eggs in one basket. Diversify. Make sure that you have a layered approach. And I see there is, oh, sure. I'm sorry. Okay, so if you are looking for the resources, go to learning and coping resources on adventfamilies.com, which is one of our products. You're welcome. Okay, just one or two more slides. I think this is the last one. Some precautions can help mitigate risk of COVID-19 transmission in close contact, such as making sure childcare workers change clothes if they get spit up on, etc., and having them wash their necks/arms if they are in contact with children's secretions can help as well, okay? So that's from peer-reviewed literature. Common sense, but again, we all know that in the thick of it, when you're busy, when you've got 1,000,001 things to do on your to-do list, it's hard to remember perhaps to have multiple backups, of clothes. So, to help you out, to help your, purse strings out, so to speak, seek out some of these exchange marketplaces so you can lower the financial burden on your business. And that is it for today. I am, as I mentioned before, the founder and CEO of Architect, and this is the second of our 3 webinars for this series, and we will return next Saturday. Does anybody have any questions? Okay, so no questions. Thank you for joining me on this beautiful Saturday. Hopefully you have an enjoyable one. Oh, I see one question. Oh, you're welcome. All right, see you same time, same place next Saturday for the final webinar. Thanks and have a wonderful weekend.